Hi, I'm Scott, your joint pain specialist from San Jose, California. And today we're going to talk about something that is normally something that plagues people that are middle-aged and older from just a lifetime of poor posture habits. But this is now a condition that's starting to affect our children. Some middle school and high school age kids are starting to have this problem. And the problem I'm talking about is forward head tilt or forward head and neck posture. So in today's video, we're going to talk about all the different muscles that are associated with pulling that neck forward way beyond a good, comfortable, and neutral position. And then we're going to also talk about what simple exercises, daily exercises that can be done to correct this neck posture as soon as possible. So without further ado, let's get to the body.
Okay, so here we are looking at the neck muscles on the human body on my little three-dimensional graph here, okay? So you can see every single neck specific. There's more. You know, your trap attaches up here. Okay, this little sheath of muscle tissue lays on top. But the main cervical or neck muscles are these right here underneath there that really control the neck in this postured position, okay? Now, the main cause of this forward head tilt is usually having poor posture habits. Okay, and what's the number one cause of poor posture habits is our sitting position, our standing position, our walking position, that kind of thing. And with the lifestyle that people are having, we're going more and more into technology and using our minds to improve efficiency, work, communication, all those kind of things. Which is good, which is a great thing, but our bodies haven't caught up to it. Our bodies are still the same type of animalistic bodies designed to build pyramids, you know, with our backs, but we don't need to do that anymore. And so in turn, our bodies get really strong in whatever positions that we're putting it in, and so then those muscles pull us into that poor position. So we're going to go over the number one causes of this poor neck posture, but this is just general. Everyone, you know, most people have a different way of how they get to this postured position, and it's not straightforward like what we're going to talk about right now. And if this doesn't help you out as much as it should, then you need to have a specialized, personalized assessment and treatment protocol created for you. And if you go click on the link in the description, you can sign up for my corrective exercise program where I myself, my whole team, we for $50, we will assess you and prescribe for you what exercises are necessary in order to correct your posture position, your whatever problem that you're having. In this case, forward head tilt, but it can be for anything that has to do with the muscular system. Okay, so let's look at this. All right, your main culprit into causing this forward head tilt is, you know, basically anything on the front half of that. Here's the spine, right? Okay, this is your spine right here, your cervical spine. So basically everything on that side, okay, what we call the anterior side, all of those have the ability of causing your neck to go forward, okay? And the reason is because they're on the front side of your body and they attach to the front side of your body. Okay, you see how all these different attachment points right here on the front half, when the muscles shorten to cause movement, okay, they shorten, that has the ability to pull your neck forward, okay, or bring your chin down, okay. Now, these muscles right here, they're not going to have as huge of an impact. They attach to what's called your hyoid bone, which is underneath your chin, has something to do with your vocal cords and actually not your vocal cords, but just controlling that little floaty bone there and keeping it stabilized. Again, here, these all do have the ability to pull everything forward and down, but they're not going to be as impactful as, say, your SCM, your sternocleidomastoid, okay? So we just call it SCM for short. This is going to have a significant higher impact on causing your head to move forward. Now, if you see how it's attached here in the back of your skull, right there, so not only, and it's attached to the front, so not only does it have the ability to pull your neck forward, but can you see how if it pulls down, it can actually lift your chin up and go into cervical extension. So it's one of the few muscles in your neck that is really good at cervical flexion, which is forward, and cervical extension. Okay, so when you have a forward head tilt, you're not looking down normally, right? You're looking up a little bit, and so that's why this muscle, this SEM, is usually the main cause of the tightness in your muscles. Okay. So these muscles get really, really strong just because of how you sit or stand or move or use your neck and head. And then these muscles back here, okay, that are responsible for keeping your neck back into its normal neutral position, they become really weak. So the most important thing that we got to do is actually strengthen these muscles. You don't want to like make this weaker, because then what's that going to do? That's just going to make you vulnerable to having your neck going back that way too far, right? Instead, you want to maintain the strength, but you want to strengthen all these muscles that are back here, and even muscles that attach to the shoulder and the lower spine and all the way up into the neck also. So all of them need to be strengthened to help support your neck and head. Okay, so let's go look at the top exercises. Oh, sign up, get a personalized program from me. Okay, so here is a general, very good, reliable mobility and strengthening routine. Okay, all of these need to be done daily. The only one that's kind of limited, you could do this one daily, this bottom one right here, number 5. This one can be done daily. I only have it listed at 3 times a week because it can also be a little stressful, okay, because it's a big body movement, and we're going to talk about that when we get down to it. It's number 5. And then the floor angels, it's the same kind of thing. These can all be done daily, but in the very beginning, I would say just doing these 2 3 times a week in the first week. See how it makes you feel. If you feel good and you're fine and you're not beat up or anything like that, then try adding it more frequently than 3. But you do have the ability to do all 6 of these every single day and multiple times a day, especially this first one, head retraction. Okay, head retraction. All right, it's very, very simple. Basically, if your head is forward, we need to start working on flexing just the neck muscles back here of pulling your head back, okay, posteriorly. Okay, it's anteriorly forward, okay, anterior side of your body, posterior side of the body. So you need to flex it posteriorly, okay, and really focusing on just these neck muscles. It'll be really easy to kind of like use your shoulders to help pull, whether it's retracting or flexing forward to kind of like compensate for that. So try to be in a seated position. That's going to be best, and relaxing your body and just really feeling your neck muscles is what's pulling you back. Okay, you want to make sure, just like in this picture here, you want to try to keep that chin neutral. You don't want it going down. You don't want it popping up. You want to try and keep it neutral the whole time. Okay, and then when you do this, you're going to see in the video. I'm going to show you the video. When you see this, the video is only going to be holding the position for a couple seconds. Try to hold it a little bit longer than that. Try to hold it for about 6 seconds at a time. This exercise that you're going to do right here, you can do this actually as many times a day as you want to, as many sets as you want to in a day. The only way that you're going to be doing too many is if you're no longer able to maintain good chin posture and you're not able to just focus on the neck muscles doing all the work. When you start feeling like your shoulders are starting to shrug up, or they're trying to help you do the movement, then the muscles are fatigued, it's done too much, and that's it. In the very beginning, it could be just after one single set that you can't do more than just one set. And that's okay. We're at a certain starting point, and the more frequently you're able to do it properly with feeling the right muscles working, the more beneficial it's going to get and the faster recovery is going to get. Okay, so I would highly encourage trying to do minimum once a day, but if you can do it 2, 3, 4 times a day, that can be really beneficial. All right, let's check out the video, see how it's done here. So forward head tilt technically is, you see the collarbone, which is right here. all right? And then you see the cheekbone, which is right there. Ideally, you want that cheekbone to be resting right over the front of that collarbone there, okay? So that's where she's pulling it right there. That's where she's pulling it back to, okay? So she's got a slight, very mild forward head tilt, okay? Nothing extreme. But see her pulling back. Now right there, she kind of like lifted her chin up a little bit, okay? Too much extension there. So you want to keep that chin down, pull straight back. And when you get to that end range, feeling all these neck muscles working back here, you want to hold that for about 6 seconds in your head, okay? Not 6 seconds from starting the movement, but when you get to the end of the movement, hold it for 6 seconds. 1, 2, 3, 4, 5, 6. A little bit slower than that. 1, 1,000, 2, 1,000, and so on to 6. And then you can relax, okay, and do all the repetitions for that. All right. Okay. Foam rolling. All right. So this is the best one I could find. So it's ideal to try to get these muscles activating and releasing and everything to have your arms crossed like how she has them. But, you know, our focus here is to try to fix this forward head tilt, okay? And with you're laying back and you're keeping your head off the ground, there's a high chance you're going to be using these neck muscles here that are causing the forward head tilt to strengthen even more while holding this position. So instead, put your hands behind the head and support your head, okay? It's not going to make that gigantic of a difference with your shoulders and what we're trying to do here. Yes, this is the ideal correct position, but what's more important is not doing things that's going to continue to strengthen these front neck muscles, okay? So go ahead, put your hands behind your head, elbows out, elbows in, whatever, okay? As best as you can. If you can't do that, that's okay. Try to do the best you can, just keeping your head in a neutral position. That's going to help out also, okay? And it's really simple. You're going to get at the base of your shoulder blades here, lift up, and then you're going to pull yourself forward, which is going to cause you to roll up the shoulder blades, and then just roll back and forth nice and easy and comfortably. You shouldn't feel a whole lot of pain. Yeah, there might be some pressure pain, but it shouldn't be that bad. Let's check out the video. See, nice and easy, rolling onto the one side, and then you're going to want to roll into the middle, and then you're going to want to roll into the other side. So nice and easy, controlling the movement, thinking about going up and down the base of that shoulder blade right there to the mid part of your shoulder blades, not all the way to the top, okay? We don't want to do that, all right? Again, we're going to be trying to help strengthen these neck muscles up here so we don't need to roll up really high, just to the midpoint, bottom and midpoint only. Okay. Chest stretch. So I really like this chest stretch because it's a really great way of isolating things, but at the same time, it's really good at strengthening the opposite side. You see, how the human body moves and causes movement is one side of the joint that's moving has to shorten, and the other side of the muscle of that joint, those muscles have to lengthen. That's just simple biomechanics. It's just how the body works, okay? We've gotten into a lot of trouble with our bodies where we try to allow gravity to pull us into position. And gravity, that's not going to fix the issue. What's going to fix the issue is strengthening the muscles that are weak to help cause the muscles that are super strong to start to finally lengthen it, okay? So when the muscles is just really, really tight, yes, we want to lengthen it, but if we're not causing the opposite side muscles to shorten, well then it's not, those muscles aren't going to get stronger, and those tight muscles are just going to retighten back up. That's just that's a fact. There's nothing getting around that, okay? Anyway, getting on a foam roller, being comfortable, having a vertical against ideally, you should have one that your pelvis, your tailbone can rest comfortably on there, and your head as well. Your shoulder blades should just fit comfortably there. You're going to have your arm hanging off, and the angle isn't very good, what you can see in this position. So the elbow's going to be bent just comfortably where you can have it flat on the floor if possible. If not, that's okay. Just try to get into a comfortable position. And then what's just going to happen is a rotation. So rotating the arm back, keeping the elbow on the floor. Okay, the elbow stays on the floor the whole time, and rotating it back from this shoulder joint here, okay? Now, the the pec muscle, if we look at it real quick, okay, it attaches here, and it attaches on the outside of what's called the bicipital groove. You have the long head of the bicep. Let's see. So you see that line there? That's where I'm guessing that's what they're considering the bicipital groove, and it attaches to the outside of that bicipital groove. So by rotating the arm out and having the shoulder blade further back, that's going to cause things to lengthen. But then when rotating back, you're going to be using, all these muscles here to help rotate everything back and strengthen these muscles back here. Okay, let's see the video and see how it's done. So resting here, you see how it's already back, and then rotating back comfortably, okay? Try to get it back as far as you can. If you can't bring it all the way back, that's fine. That's not a big deal. And you don't have to have your elbow lined up in line with the shoulder here. It can be lower, it can even be higher. Higher would actually be a higher level exercise, a higher stress. So in the very beginning, definitely try to be in the elbow in line with your shoulder at the very beginning. If that's uncomfortable for your shoulder and everything, you can bring it down lower. More than likely though, you wouldn't be able to bring your hand all the way back. But as it gets more comfortable and stronger, and really focusing on flexing these back muscles here to help cause this to lengthen, this chest muscle there, then you'll be able to bring the elbow up higher and even get the elbow above the shoulder. Not crazy above, like you're trying to reach your hand back here, but just a few degrees above the elbow, or the shoulder, excuse me, like maybe 5 degrees at the most. So it's not a lot. Okay, so let's go back. Okay, floor angels, all right? This one is a favorite, but man, it can be difficult. If you're having neck issues, there's a good chance that this could cause some tingling or numbing sensation in your hands. As long as it's tolerable, try to push through as best as you can. If it doesn't get better or anything like that, then you might need to really talk to your doctor, your primary healthcare provider, and just making sure there's nothing structurally messed up in there that's causing a problem. Ideally, your forearms are going to be flat. Ideally, your wrists are going to be flat. Ideally, everything's going to be flat. Now, if the person had their legs straight, there'd be an arch in their low back. But because their knees are bent and their feet are in close, that causes the low back to flatten. So don't think about having to force your back flat with your knees bent. It should just be comfortable, and you shouldn't feel any kind of stress in your low back or anything like that, okay? Now, what's really important is that you don't arch your back, okay? Everything below your shoulders needs to just relax and stay still. It's very easy to cause more range of motion by arching this low back, because that will cause lift in the rib cage, which then opens up more range of motion for your shoulder blades, okay? Now, the whole point of this is to maintain your head resting back. Now, if you can't do that because it's too painful for your forward head, then you can use a pillow, okay? Have a pillow resting there, but ideally, we're gonna want you to be flat on the ground there, all right? And there's a lot of muscles that attach to the shoulder blade, that also and to the collarbone, that also attach to the neck and the base of the skull, that are going to help out with this movement. So this is a really important strengthening movement, even though it is mobility as well. Okay, let's check out, let's look at the muscles specifically. Okay. All right, so the big one here is going to be this trap. Okay, you see how it can pull that shoulder blade up towards the neck and skull right there? So that's going to be a big one. Let's see. Okay, your rhomboid minor, major, your levator, it's going to be helping out with that one as well. There's obviously some deltoid action is going to be helping, but then on an isometric level, okay, with your head staying flat on the ground and not lifting up, all these local neck muscles right here, okay, they're all going to be helping correcting the posture position of you just keeping it still on the ground, okay? True isometric, true stability training is where the joint you're trying to strengthen the stability of is not moving, and joints around it are moving. Okay, so this neck is getting a lot of strengthening done if you're able to keep it perfectly still and flat on the floor here. Okay, and then there's movement strength going on here, but there's posture strengthening going on back here while you're doing this movement. Okay, let's watch the video. Getting in position, anywhere from level to the shoulders or below, and then reaching up. Now, the important part here is not focusing on trying to straighten the elbows. That's just what naturally is going to happen. The big thing that you're focusing on is the shoulder blades rotating, okay? So the shoulder blades have to rotate like little wings in order to cause your arms to be able to move up like that. So you really want to think about those shoulder blades moving up and down, rotating up and down, while also keeping your head relaxed and staying put as low as you can on the floor. You don't want to be feeling your head coming up. That will be a cheat because that is a stronger position for your body. Okay. Okay, so that one was like 3 times a week. Now we're gonna go to the other one. This one's kind of intense. It's very easy for people to push their head forward while trying to do this. Okay, so this is gonna be difficult. The primary thing is pretty similar to what you just saw with the last one, focusing on the shoulder blades again. Now, the arms are going to be rotated back into this like 90-ish degree position here. And you're going to pull back to wherever's comfortable to pull back. And then what you're going to do is you're going to retract your shoulder blades to kind of like bring your arms and hands further back. So it's not like you're pulling with your arms. You're more pulling with your shoulder blades, trying to cause that further rotation back. And you're just going to hold it there for 6 seconds is a good time. You'll only see it holding for a couple seconds while doing it, but 6 seconds is going to be ideal. But again, there's going to be a huge tendency to push that neck forward to cause everything to come back. Don't do that. Okay, we don't want to be doing that. And the muscles that we're going to be working on, are the same ones that we just worked on with the upper movement. Okay, these traps, then the later, rhomboid minor, major, but then also keeping your neck in position is going to be all these back neck muscles, okay? The posterior scalenes especially. All right, so the last thing you want to do is feel like your head's going forward, okay? If you can only bring your arm back a certain range and any further back causes your head to go forward, then just work in the range that you can control. All that's important is that you're maintaining a good neck position, because again, that's what our focus is. Our focus isn't on the shoulders. All that's going to help and it's going to make it better and stronger, and we need to try to get as good as we can doing it. But most important thing is keeping your neck in a good postured position, okay? So let's check out that video and you can watch it. So she getting in position and then squeezing back and then relax. Okay, you can keep your arms bent. You don't have to fully relax just like how she did. But it is a good idea to do that, but it's a lot sometimes. So really make sure that that neck is staying in a neutral position and that the shoulder blades coming back, these shoulder blades coming back aren't going up, okay? Notice how she's not pushing her shoulder blades up, okay? And you shouldn't be thinking about pushing them down. They will come down a little bit just because of what's happening with the retraction and everything, but it should feel more straight back as opposed to up and back or down and back, okay? Hold it for 6 seconds, each repetition for each set and rep. Okay. Last but not least, doorway stretch. Now, people do this doorway stretch really inappropriately because it puts a lot of stress in the shoulder joints, okay? This is I'm going to show you a different way of doing this exercise, which is going to be a lot less stressful, but just as impactful as helping out with the shoulder and neck posture position, okay? So make sure that you're in a neutral position here with your neck. Again, that's really important with what it is we're doing. And then all this person is going to be doing, you'll see this a lot clearer in the video, is you're just going to get in a comfortable position and then rotating away, all right? Keeping your head in a good, tall, long position, okay? Not leaning forward, all right? We're not wanting to go forward. We're going to turn away. because that way we're reinforcing that good neck posture position. We are strengthening the back muscles here because we're actively moving into position, and we're allowing the lengthening to happen as much as possible. Let's check out those muscles again. Okay, so with rotating the neck, so you'd be rotating this way if you're doing this as the person's right arm. So these muscles will stretching and lengthening, but then back here, these muscles all back here, everything that's associated with on this back side and some on this other side will be helping pull and rotating that neck and squeezing everything and pulling the shoulder back. Okay, let's check out the video and see how it's done. See how she's just twisting, a little bit of torso twisting, okay? It's not leaning forward. By leaning forward, you get a great stretch, but you also put a lot of stress in that shoulder. And it's not really, it's not, the benefit outweighs the amount of stress that's being put on the shoulder here. So instead of hyperextending the arm, instead just have your body in a neutral position, maybe slightly, like a couple degrees forward, but then just twisting your body, turning your head and keeping your neck straight as best you can. Holding it there for about 6 seconds is ideal for each repetition, okay? There, now that you've finished doing all these exercises in a day, then it's important to reinforce this good neck posture by maintaining good neck posture all day long, okay? It's really difficult to do that, to really think about trying to stay straight. The best tip advice I can give you is to think about just trying to lengthen your neck, okay? So think about trying to push your head in a straight position, the top of your head, straight up towards the ceiling. By doing that, that kind of like gives you, your muscles, the ability to like think about lengthening that spine, which will make you stand and sit more upright. So if you think about trying to lengthen that spine, okay, but not hyperextending your back and pinching anything, and trying to maintain that posture all day long as best you can. Reality is you're not going to. If you're lucky, you'll be able to hold it for 30 minutes or an hour. But what is important is being consciously aware of how your neck posture should be. So if you're being consciously aware, when you realize that you're starting to lean forward again, by quickly correcting that, you're going to help reinforce good neck posture, good sitting posture, standing posture, whatever it might be. And over the course of these next 4 weeks, we'll have a significant improvement in your neck posture. Okay?
Well, that's it. That's it. That's all the exercises that's necessary in order to correct forward head tilt. And by correcting that forward head tilt, that forward neck posture, then less stress will be going into the neck, less headaches, less shoulder issues, less back issues, and a higher quality of life. A lot of more energy, all the things necessary in order to have more joy and happiness in your life. So thanks for making it to the very end. I really appreciate it. Do me a favor and subscribe, click the like button, and then I will see you next time. I'll talk to you again soon.